How we doing? Nate Moe from Moe Strength here. Going to do a little bit different video here. I've got an article that was printed in our local paper here, and one of my clients gave it to me here a couple weeks ago from Dr. Rosen and Dr. Oz. I apologize if I'm saying his name wrong. And the comment or the article is higher muscle strength linked to lower type 2 diabetes risk. And they go through a study and talk about all of that. And most people don't get enough strength or don't do enough strength training. Men, it's 35%. Women, it's 27%. Of those with type 2 diabetes, 88% don't do any strength training. Well, this study showed that regardless of your genetic predisposition for type 2 diabetes, there's a 40% chance or 40% reduction in getting type 2 diabetes if you strength train or if you have higher muscular strength. And that's great. They're trying to push that. But my problem with this article, this silly article, is then the recommendation. And they say the best thing is a combination of aerobics, and that builds muscle too, like walking, biking, and basic exercises like that, and then some type of resistance training with bands, body weight, machines. And okay, yes, going for a walk, biking, all of that aerobic stuff is great, but it's not going to build muscle mass or muscle strength unless you're severely detrained. And then it's going to help build a little bit of strength for maybe 8 weeks, and you're going to adapt to that. And walking, unless you have severely weak bones, is not going to build bone density. It's not intense enough. We know this. If you look at the Lift More study that was done on women, postmenopausal women with osteoporosis, they're at a high risk. You would think that they would have to start off really slow and do little things. The study, they showed just a basic program like what this article is recommending, didn't do anything. They didn't see an improvement. But starting a progressive resistance training with squats, deadlifts, presses, and a form of a vertical pull or a jumping chin up, I think they called it, improved bone density, strength, and all of that, and was very safe and effective. It just makes me mad. I've got clients from 50 all the way up to 84 that squat, deadlift, and we started them out slowly learning the proper technique, utilizing their body weight, and some needing assistance first less than body weight. And then we're able to progress with a dumbbell, kettlebell, PVC pipe, progress up. And this notion that you're building strength or muscle mass with aerobic activity is important, yes, but we're actually seeing that maintaining muscle mass is extremely important for all sorts of factors. And that intensity of strength training is great for fighting that insulin sensitivity or becoming insulin resistance. It fights that. It really helps. It utilizes the blood sugar or the glucose, so it's not in the blood, and it upregulates so your muscle is better able to receive that. There are so many benefits, and I had a client sent me today. He went back to his annual checkup, and he's not diabetic, but he was on his way to that, and he has halved most of his medications. His A1C is way down. His blood pressure is way down. All of his blood sugar is way down. So he's halved his medication. He's 52, and I can say that we are stopping his road to type 2 diabetes through strength training. Yes, he does some cardio, but with me, he strength trains once a week, and then he does 1 or 2 days on his own. I've got another client who's 77 who is type 2 diabetic, and he has dropped a ton of his medications either in half or gotten rid of them, and his A1C and all of his numbers have improved. And we started with just basic body weight, squats, hinging movements, pulling, pressing movements at an appropriate volume and intensity, and then we progress just consistently over time. And that 77-year-old individual, I did a video on him. He's deadlifted 225 pounds. He's squatted 150 pounds for reps, and he's just crushing it. The client that sent me the thing tonight, he has dropped body weight. He has gotten stronger. He really became sedentary after a back injury and has come back. And we've got a slow, steady, consistent process, but he feels better. He moves better. His back is better. He doesn't hurt as much in the morning, and he is able to squat with a barbell. He is able to deadlift with a barbell. He is way more functional and is setting himself up for the next 30 years a much different path than if he just did some light walking and didn't really, this really irks me. You're on the right path, and then you just, when it comes to the recommendation, you just, come on, people, we can do better. I can help you at MoStrength.com. If you're interested in joining the resistance, reach out to me. I train people in person at the Power Shop gym and do remote coaching as well. I've got clients at 84 years old, remote coaching. I've also got an 84-year-old that trains with us here at the Power Shop. Yeah, that's my rant. I guess it just irks me. You're pushing the right thing, but then when you come to it, you're so cautious and you don't really give the proper recommendation. We know there's studies out there. We know about the Lift More study. Look it up. I did a whole presentation on that about 6 months ago. And just start at the level you're at. Start with low volume, low intensity. Be consistent, steady progression with good technique, and amazing things can happen. Would love to help you. Please like and subscribe if you're interested in content like this, and if you're interested in becoming an athlete at aging and joining the resistance, please reach out to me, MoStrength50 or MoStrength.com. Would love to help.